All right, here we go. Hi, I am Tash, the owner and therapist here at Remedialite Massage, and I'm going to do my best to try and fit all of this into a video for you around my personal journey with lipedema and to help those of you who have never heard of this chronic condition to maybe understand it a little bit more if this is the first time you're hearing about it. So, lipedema is a chronic disease that affects loose connective tissue such as that of fat cells, as well as the surrounding tissues. It affects roughly 11% of the Australian female population, and yet it is one of the most unrecognised chronic diseases in our healthcare system currently. My personal journey with lipodema began in about 2020 when I started to think that maybe I had this. I first heard of it from an online influencer when she was sharing her story of her recent diagnosis after documenting her weight loss journey. I heard about it, and then my sister also happened to follow the same person, and she came to me one day and she said, "Hey, her story and your story, there's a lot of similarities here." So, with that, wanting to learn more, I went to my GP at the time. They took one look at my legs, poked it, and went, "No, you don't have any swelling, you can't have that." So that was the first of many dismissals that I experienced with this. I was then transferred to another GP within the clinic, and I spoke to them, and I got a similar dismissal treatment, being told, maybe you do, but you just need to exercise more and focus on your diet. I'll refer you to our dietitian. Dismissal number two. The dietitian treated me like I was in primary school. They drew a circle on a piece of paper, divided it up, and said, "This is how much of your plate should be protein, this is how much of your plate should be carbs, and this is how much of your plate should be fats." Dismissal number three. So naturally, I gave up and I decided to do my own research, and I joined the online platforms for the lipedema support groups. Now, lipedema isn't recognised by Medicare in Australia or allied health funds, so the information and the management for what I was discovering was all at my own expense, with surgery being the biggest cost. Think upwards of 30 to 40 grand per limb. So, in fact, it isn't even a condition that is studied at medicine school, which is why there is such a misdiagnosis and a lack of understanding in our medical system here. Through these support groups, however, I learned a little bit more about lipedema itself and the ways that affect a person and where I could go to seek diagnosis. The largely common symptoms that you'll hear lipedema sufferers talk about is easy bruising, joint pain, muscular pain, disproportionate legs and arms to the rest of the body, swelling, because you can actually develop secondary lymphedema from this chronic condition. But the most common thing that most sufferers will tell you is that it is debilitating at times and it takes its toll mentally. So, after trying to manage and do my best for approximately 4 years, I decided it was time to seek a diagnosis, especially after I had a conversation with my GP who told me that if I didn't reach a certain weight within a certain time frame, the next conversation that we were going to be having was about the weight loss surgery. That was dismissal number four for me. So even though I had seen in the support groups a lot of people having the weight loss surgery and having great results from an overall weight point of view, the disease tissue stayed the same. And so for me personally, it wasn't an option that I was considering at the time. So my official diagnosis came in late March this year in the form of an occupational therapist here in WA that specializes in lymphedema. Lymphedema doesn't have a particular age onset. It has some small traces of hereditary elements, but mostly it's all hormone change based with life events such as puberty, pregnancy, and menopause. For me, I've discovered that it was puberty, and I can actually recall my entire teenage and now adult life. I've always had disproportionate body setup. My legs have always been bigger, no matter how active I was. And I mean, I did netball, athletics, rowing, dancing. I was very active as a teenager. But when I look back at photos, I can always see that my waistline, my legs. So, how do I manage this condition? Well, I have a full professional team around me that help me with multiple areas of this chronic disease. I have a trainer who writes me a 6-week weight training program for me in the gym. I have a clinical nutritionist that helps me stay on top of my nutrition for fueling my body and not the lipedema. I have a lymphatic therapist that I see every fortnight for manual lymphatic drainage. And I see the occupational therapist who diagnoses me every 4 weeks for scans to see how my body is responding to the management that I'm doing. And I also take Manjaro, the injection. This enables me to train pain free and maintain the nutritional program that I'm on to continue making the progression in my management strategy. Now, remember, this is an all out of pocket cost to me. My allied health only covers a small portion of the likes of the MLD and the nutrition. Now, there are many other ways to manage this condition as well, with the likes of compression garments, compression pumps, and surgery. Everyone's management looks different depending on their stage of disease and sadly their own financial limitations for this. This is not a curable disease. This is something that is a lifelong management strategy plan. Being diagnosed has changed my outlook on a lot of things, mainly how I view nutrition and exercise. The gym used to be a dirty word for me, but now I understand the importance of it and for me on my journey, and I've changed my relationship with foods as well. Some days are tougher than others, I won't deny that, but overall my outlook is that of management, not weight loss, not perfection. And I'm really proud to say that I'm a lipedema warrior and I'm out here doing the best that I can do for myself and to help raise awareness of this chronic disease and to educate those that haven't heard of this, as well as make others who feel like their voice has been silenced to realize that they're not alone. You're not alone. There's many of us out here fighting. We'll keep fighting. We'll keep spreading the word. And I hope that you've all learnt a little bit about lipedema and how chronic and debilitating it can be, as well as a little bit of an insight into my personal journey.